So, good day again, dear super moms and super dads. It's me, Dr. Balvin. Again, I'm an infectious disease specialist, and my topic for today is leptospirosis. So, again, as a disclaimer, this is not an industry sponsored lecture intended primarily for parents and healthcare workers. I am not giving medical advice, and of course, we do not replace sound clinical consultation in the presence of signs and symptoms. So, to begin, we all know that leptospirosis is very common now in the news. If you look at it, ever since the start of 2025, we've seen a lot of cases of leptospirosis, and I think from January to July, the DOH recorded a total of 3,037 cases as of this time. So we see a lot of cases. Not only do we see a lot of cases, we also see a lot of deaths and leptospirosis. So we will tackle on how leptospirosis affects the body. We also want to tackle how it is transmitted and how we can prevent ourselves in having leptospirosis. So to begin, we want to ask, so what is leptospirosis? Actually, it's a bacteria which is more of a corkscrew-like shape. This is caused by what we call a spirochete bacteria called Leptospira, and common in the tropical and subtropical countries, most especially here in the Philippines and in South America. And yearly, there are more than a million cases, including 60,000 deaths. I do not have the total number of deaths right now in the Philippines, but in Quezon City and Metro Manila, I think there are more than 20 deaths already. And if you look at the background of leptospirosis, we tend to note that the outbreaks tend to occur after a heavy rainfall or flooding. So you will see streets being flooded. I think it's a very common issue recently, since we know some of the drainage systems have been clogged or was not properly maintained or was not properly designed. So we've seen a lot of cases of heavy flooding even in areas 1 week after the storm hits. There's still flooding in some areas, especially in Metro Manila. So the high risk areas are those with poor housing, drainage, and sanitation conditions. This is very common. So, since this is a bacteria, we want to ask ourselves, how is it transmitted? Looking back, leptospirosis is usually transmitted through the urine of infected animals. It can be your rodents, dogs, pigs, etc. So if you have a animal there in your home, or a rat, most usually the classic example is a rat or a mice. If they urinate, especially in a heavy flooded area, that can spread the bacteria. So the bacteria can survive weeks to months in a urine contaminated water or soil. So if you do not clean or drain the flooding waters immediately, you can really have leptospirosis. And usually it enters the body. How? Especially if you have some cuts or bruises, you can have it. To the oral mucosa, you can also have it. Human to human transmission is rare, since again it's from the urine of infected animals, but it is possible through sexual intercourse and breastfeeding, although it is very, very, very rare. And like what I've said a while ago, the open wounds can be a portal of entry for those bacteria to enter your body. So if you have leptospirosis, you have to take note the signs and symptoms. More often than not, the clinical symptoms usually is high fever, you have red eyes or what we call conjunctival suffusion, abdominal pain, headache and muscle aches, chills and rashes, nausea and vomiting, diarrhea, and of course, yellowish discoloration of the sclerae in severe cases. And when it comes to infectious disease, we want to take note about the incubation period. So when we talk about the incubation period, again, it's the time when the bacteria enters your body and when the signs and symptoms appear. So usually for leptospirosis, it's 2 to 30 days, but with an average range of 5 to 14 days. That's why if you notice, after a flood, you do not really immediately after a flood, you do not get the signs and symptoms yet. So the bacteria will spread throughout the body and usually comes out around 3 to 5 days, or as early as 2 days. Alright, so sometimes you might wonder, oh, it's not flooding anymore, but why do I have signs and symptoms of leptospirosis? But because again, you have to take note of incubation period, which can go last even as long as a month. So more often than not, most people do not have symptoms. They can tolerate the bacteria, they can deal with it. Some you can go from a sequelae of or mild fever to severe or multi-organ failure. That's the spectrum of leptospirosis infection. As for the signs and symptoms, you have fever again, headache. What's prominent sometimes in leptospirosis is the presence of calf pain, red eyes or yellow skin, abdominal pains are very common. This is just an example of conjunctival suffusion and also your ulcerative relation to sclerae. And if you're not careful with leptospirosis, it can really lead to renal failure and pulmonary hemorrhage. So that's the most common, based on my practice, that's the most common exit or cause of death, especially when you have severe renal failure and pulmonary hemorrhage. Renal failure to the point that you will really have dialysis. You have acute kidney injury, and most patients who succumb to acute kidney injury really need to undergo dialysis. And pulmonary hemorrhage is one of the saddest things to happen. Okay, and it really happens to adults and most especially to young children. Uh, Although rarely, pregnant women can have leptospirosis, which can also lead to fetal death or abortion. So, when it comes to leptospirosis or any kind of infection, there has to be a balance between your body's immune system and how it deals with the infection. More often than not, if you have a balance of pro-inflammatory and anti-inflammatory response, you can maintain a state of homeostasis, which can decrease the leptospirosis colonization, and eventually you will be treated with the infection. But in some cases, for some, more reasons or not, there's an imbalance wherein there's more of a pro-inflammatory response compared to the anti-inflammatory response, which can lead to what they call a cytokine storm, which can increase again your leptospirosis numbers or leptospiremia with a sepsis-like phenotype, which can eventually, this cytokine storm can lead to multiple organ failures, failure of the kidney, failure of the heart, the brain, your failure of the lungs, and hemorrhages and death. So more often than not, the exit again is your pulmonary hemorrhage. So what do you do if you suspect to have leptospirosis? You want to ask yourself, what are the available tests, especially here in the local setting? Uh, Here in the Philippines, what's the common test available is your leptospira IgG IgM. We also do a leptospira MAT or microscopic elucidation test, but more often than not, we send it to reference laboratories like your Research Institute of Tropical Medicine or RITM. In some countries, they have PCR for blood, urine, and CSF, and you can also do a biopsy of the kidney, although this is a very invasive type of procedure. But more often than not, the most common we have is your Leptospira IgG IgM, which is usually available in all hospitals in the country. And it's also a cheap test, so it's not a problem. So if you're suspecting to have leptospirosis, you can do Leptospira IgG IgM. In case you have leptospirosis, what are the treatment available? Because of course, most of us want to be treated immediately. So if you're feeling sick, if you have your reddish eyes, yellowish skin, vomiting, or recent exposure to of your open wound to a flood, so of course you have to visit your nearest health center. That is a must. Okay, for mild symptoms, you can give your antibiotics, which are doxycycline, acid, and amoxicillin, which is also part of your post-exposure prophylaxis. But for severe disease, you really have to admit them. We encourage fluid therapy, IV penicillin, which is of course the drug of choice for leptospirosis, and in severe cases which leads to AKI or acute kidney injury, you have dialysis. And in the very extreme cases, very extreme cases that have pulmonary hemorrhage, usually there's really intubation involved in these cases. As healthcare workers, of course, as anesthesia specialists, we have to put emphasis on the prevention. Okay, so prevention really is better than cure because it would be better to prevent leptospirosis. So how do we prevent it? Of course, and that's here in the technical or the government side of things, there should be proper flood control measures. I will not elaborate on that. It's more of an engineering problem and more of a technical problem. But again, for schools, communities, barangays, subdivisions, cities, bridges, wherever, there must be proper flood control measures. You have to avoid, if possible, avoid wading or walking in the flood, bathing, avoid swallowing or swimming in contaminated water after a heavy rainfall or flooding. I know some of the children really love to swim in the flood or in the rainfall. I've seen a picture wherein they use a parking lot as a swimming pool. So again, avoid that. That can be a focus or an opportunity for leptospirosis to occur. If exposure cannot be avoided, you must wear the appropriate PPE or personal protective equipment, which includes your rubber boots, your gloves, and your waterproof coveralls. As much as possible, keep your rodent and other animal population under control. You have to make sure that there are no rats or other animals like your dogs and cats, especially if they die during the flood. You really want to dispose of them properly. And of course, very important for our super moms and super dads is to seek early consultation. If your child is not feeling well, contact your physician. I think they said that all municipalities now have a doctor, so you should go to your nearest clinic or nearest physician. If possible, you take your pre-exposure and post-exposure prophylaxis, which, as the antibiotics I mentioned before. So for children, you can give your azithromycin and amoxicillin for them. If you're scared, to give your doxycycline. So in prevention of leptospirosis, the World Health Organization encourages again wear protective clothing. If you have skin lesions or wound, and if you need to wade to the flood, you have to cover your skin lesions with waterproof dressing. Avoid wading or swimming in potentially contaminated water. Wash or shower after potential exposure. Clean your wounds. Do not touch, of course, your sick and dead animals. And consume clean drinking water as much as possible. Even if you're thirsty, you still have to find clean drinking water, because you have to remember, in terms in when floods come, it's not only the leptospirosis you have to take note of, or you have to be wary of. You also have to be wary of other waterborne diseases like your amoeba, your giardiasis, and sometimes you do not know if somebody or some person has urinated or defecated uh, in that flood water or drainage system. So it's very important to find and consume clean drinking water. This is very, very important. So I think that's all for leptospirosis. If you have any more questions, or if you have any more topics you would like me to discuss, especially for the parents and our primary healthcare workers, just message me again in my Facebook page or in my channel. So to everyone who's listened, I really appreciate your time and thank you very much. And I hope you learned something today. See you next time.